Have you been suffering from pain down the very bottom of your lower back or going into the glute region? Then this could be SIJ pain. The SIJ stands for sacroiliac joint and sits at the very bottom of our lower back or the lumbar spine. The main job of the sacroiliac joint is to distribute weight between your upper body and your legs. Now, what are the common symptoms of SIJ pain? So you normally hear people describe of pain in the lower back, right down the bottom, often more into one side. Pain in the buttock region, so through the glute region, or sometimes into the groin region as well. Often discomfort when sitting for too long, and you'll find you'll have to kind of move around in the chair and nothing will really be that comfortable to be in a seated position. Often pain that is worse when you're going upstairs or getting out of a car. Stiffness or reduced movement through the lower back. And often pain that radiates down behind the legs, but unlike sciatica, it doesn't go below the knees. So some common causes of SIJ pain can be pregnancy, and this is due to hormonal changes making the ligaments a little bit more lax. Leg length discrepancy is a huge one. By having uneven leg length discrepancies, you put an uneven amount of force going up through one SIJ compared to the other. Trauma straight into the SIJ region. Arthritis, when the joint starts to wear out. Okay, so fun fact, guys, the SIJ actually moves very little, and we only really get 2 to 4 millimeters. Okay, so if you want to know how to self-test yourself for SIJ pain, here are 2 simple tests. Number 1, we can lay on our back, one leg straightened out, the other hooking the ankle above the opposite knee, letting the leg sink to the outside. If you feel pain going through right down the bottom of the lower back in the sacral region to one side, there's a strong chance that this could be coming from the sacroiliac joint. Now the next test, pulling one knee all the way into the chest. Now often with this one, as we pull up, you can start to get some pain going through the SI that you're actually testing here. So all the way into the chest, testing one side, all the way into the chest. And an obvious positive for this one is local pain through that SIJ to one side. Okay guys, so we are going to go through 6 amazing exercises that may help you really get rid of that SIJ pain, get the SIJ moving evenly on both sides. For the first one, we are going to be laying on our back, interlocking the fingers around and behind the knee, pulling that knee all the way into the chest. Now we want to make sure there isn't too much pain here. If there is, you might need to back off the amount of hip flexion that you're achieving. But if we can get it all the way into the chest, we're going to go for that. Now what we're doing in this position, we're going to go 90 degrees through the ankle with dorsiflexion. Imagine you're doing a leg press here. We're going to resist with the hands, push out, hold 2, 1, so pushing out for 3 seconds, and then pull that knee into the chest even more. So as we push out, we should be activating the glutes. And as we relax, we should be almost feeling a stretch through the glutes, but we're almost getting movement and promoting movement through the SIJ on this right side. So once again, we're going to be pushing out, resisting with the hands just for 3 seconds. As we breathe out, we relax, we pull the knee all the way into the chest, and hold it here for 5 seconds. So after 5 seconds, breathing in, pushing out, and then breathing out, let it come all the way up into the chest. We're doing this just for 7 repetitions. And it's always good practice, pushing down, always good practice to do this on both sides. Because often with SIJs, we can get one side moving and then it's moving better than the other side that we haven't focused on. So with our rehab, you want to hit both sides. So 7 repetitions with that one there. The next one we are going into, we're going to hold a static stretch. We're pulling this knee towards our opposite shoulder. So up, straight up towards the opposite shoulder. We can go arm out to the side here. And what this is stretching is a tiny little muscle that runs from the SIJ and across, and it's called the piriformis. So we're gonna get a little bit of glutes here, but mainly piriformis. We're holding this stretch for 30 seconds. So after the 30 seconds, you can let the knee move around for a sec, slowly drop down, go into the other side, pull it towards the opposite shoulder, let the arm come out on the ground there. And you'll often feel that one side's a little tighter than the other. Okay, so for number 2, this is similar to the last one. This is designed to get that little bit of movement, which remember we talked about 2 to 4 millimeters of movement in the SIJ. So often there's one side that is moving that 2 to 4 millimeters, one side that isn't, and that can cause all the issues. So this one here is designed to get things symmetrical and the SIJ moving on both sides. So we're gonna do this on both sides. What we are doing, one knee goes above the dowel stick or your broom or whatever you've got at home, the other goes below. Knees drop down to 90 degrees, holding the stick, broom, whatever we've got at home super firmly with the hands. We are going to, as hard as we can, slowly activate, pull one knee up, push the other down as hard as we can. Now, often when you're really sticky and stuck through one SI, you'll actually get a little crack or popping sound here. If there's no pain with that, that's great. Well, it's what we call a cavitation, and that can actually almost lubricate the joint and bring some synovial fluid in. We're holding this for just 10 seconds and then a slow release. Change the sides. So other right knee goes above, and then the same thing here. Squeeze down as hard as we can, squeeze up with the other knee. Squeeze, 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 squeeze. This should be pretty tricky. Really hold the stick, make sure it doesn't fly out. And after 10 seconds, little rest, changing sides. We're just doing 5 on each side here. So big squeeze up, 10 seconds. And good. So after you've done 5 on both sides there, guys, this one will often feel really good afterwards. Like you've got both sides moving, things are a lot more symmetrical, and there's one side that isn't as locked up as it was beforehand. All right, and for the next one, we stay laying on our back. So what we are doing here, we're trying to get a little bit more glute activation. So we're gonna do this, what we call unilateral glute work, which is, you'll see in a second, we're going to lift the hips literally an inch off the table, drive the heels into the table, tuck the pelvis under, and then as long as we've got the strength to do this, we're gonna lift literally one heel off the ground just an inch, holding that, keeping that pelvis tucked. 5 seconds, slowly drop it down, and then step up on the other side. Now what I don't want to see you do here is as you go drop into this side, you let the pelvis roll forward and the glutes aren't doing as much. You're extending through your lower back. That's not going to do us any good whatsoever. So make sure as we go between sides, we're tucking the glutes under, we're putting that weight into the heel and making sure if we tap the glutes, as we step into that side and lift the other off the table, should be rock solid. So really make it work, holding for 5 seconds. We're doing 6 on each side here. Tuck it under, hold. 3, 2, and 1. Slowly transition. The other thing to focus on here, guys, is to keep this pelvis flat. I don't want you rolling side to side as you step to side here. So slowly stepping, keeping it flat. If you had a bucket of water resting on your hips, you're not losing that water out of the bucket. And good. So after you've done your 6 reps there, guys, we'll get into the next one. Okay, guys, so for the next one, we are using, this is a Pilates ball. If you don't have one of these, we can use a slightly deflated soccer ball, volleyball, whatever you've got at home that can kind of mimic this. But slightly deflate it and it'll make it a little easier to keep between the knees. From here, we're going 90 degrees in the hips, 90 degrees in the knees, ball between the legs, arms beside you. I actually like to go palms down. Squeeze the knees into the ball, and then from here, we're slowly letting the hips sink to one side, but we're gonna keep the pressure into the ball, and then slowly lifting. So the whole time we're trying to keep even pressure squeezing in, and we're going through just 12 here, up and down. So 3 seconds into one side, going down, rolling down. You can see here it's a matter of inches. Maybe 2 or 3 inches drop, 2 or 3 inches lift, but we've got to keep that pressure squeezing in, keep the knees and the hips at 90 degrees, and getting all the way through here. So we should feel the adductors working. This is trying to stabilize the pelvis, especially where it attaches into the front, almost on the opposite side of where the SIJ is, but we want an even pull between sides, because sometimes this, if it is pulling a lot harder on one side and we're unable to move, there's a little bit of movement going through the pelvis here, that can cause the SIJ to be very locked up and get really irritated on one side, and that's what we don't want. So this one here, you'll see my hips are moving slightly. It'll really promote the hips to start to stabilize and become even. Okay guys, and with the last one, what we're going to do here, as long as there's not too much pain, is step up. So we want something that's just below hip height. Hip height may be a little high. So depending on how your flexibility is and how much mobility you've got through your sacroiliac joint here, it'll depend on how high you can go. So a bed can be good, a couch is often a little too low, a kitchen dining chair can be great. So play around, find something that's a pretty good height for you. You're gonna place your foot up on that surface. We're gonna place the hands on the table, and then from here, with this back leg, we should be able to drop straight through it. And as we drop straight through it, this knee is gonna sink straight into the chest, and we're going straight into that hip flexion. Now, once we're in this position here, what I want you to do is to try and give like a 5 to 10% effort push, but we're not pushing ourselves up. It's just applying a little bit of resistance, like we're almost about to lift, but we're not. So we're holding that half lift for just 5 seconds. After the 5 seconds, breathing out, relax deeper into the stretch, making sure that knee comes straight into the chest, dropping this back knee down towards the ground. So once again, applying that little half lift, but not actually lifting, just trying to push down into the table, put more pressure into the table, and then as you breathe out, relax, knee comes even further up. So we're 5 repetitions on both sides here. Make sure there isn't any pain through your lower back or your SIJ here. Little push up, 2, 1, breathe out, relax, let that knee sink into the chest, and let that mobility improve. So make sure we do on both sides. You're doing your 5 reps, you do the little push, and you should notice that that SI in the end starts to really mobilize and you get a lot more movement through it. Okay guys, so thanks for watching today. I really hope that this helps you. Remember that completing this every day is way better than doing one big session a week. So find a part of the day that you can add this into your routine and try and do this the same time every day, as you're more likely to achieve this. With all common conditions, we are covering a lot of these injuries and rehabilitative ways to get you back on track. So be sure to check some of those out. Take care guys, and we'll see you next time.